It's very unfortunate that some of them, they have recurrence of this follicular thyroid carcinoma. So we'll see how we are going to deal with. When you go for a regular follow-up, they'll ask for a few tests. These are serum thyroglobulin, T3, T4, TSH, and blood levels of calcium, phosphorus, and magnesium. The most important in this is going to be serum thyroglobulin as far as recurrence is concerned. Whenever there is a rise in the level of thyroglobulin, it means that there is thyroid tissue in the body. If there is a thyroid tissue, there can be follicular thyroid carcinoma also. If it is on the rise, the serum thyroglobulin level is on the rise, we will need the following test. To start with, we need an ultrasonography in neck and MRI scan with contrast. We may need iodine scintigraphy. I have put a question mark, I'll tell you why. And we also need to know whether it has spread to any parts of the body. So, it will be advisable to undergo positron emission tomography, PET scan 2. Molecular studies and immunological studies will be, of course, it will be of help. See, I put in a question mark under iodine scintigraphy. Why? See, initially, when we have diagnosed follicular thyroid carcinoma, and you have undergone this iodine scintigraphy also, these follicular cells in the cancer, it easily takes off iodine. So, for a diagnosis is very easy. Now, what happens is when there is a case of recurrence, these cells can undergo different de-differentiation. So what happens is it will fail to take up iodine. When it fails to take up iodine, even if there is a cancer sitting there, since iodine is not been absorbed, not been taken up, the test will come as negative. That means we will think that there is no malignancy there. So instead of iodine, sometimes we prefer thallium, system AB, or tetraformin. That's why in the previous slide I put a question mark. So one of these three can be of help. So in case a MRI with contrast is positive and it coincident, when you compare with the PET scan and the scintigraphy done, there is an uptake and we are for sure that there is a recurrence, it can be well dealt with. So the treatment plan is going to be radioablation. In case of small swellings like lymph node enlargement and previously the patient has not undergone a neck dissection, in that case the patient can undergo neck dissection. If suppose there is a spread from the primary site to some other sites, it can be managed with external beam radiotherapy. So under TNM classification of malignancy, suppose a staging is 1 and 2 in early case of stage 3, it can be easily dealt with. You don't have to worry. This cancer can be well taken care of. Hope this video, all the 5 parts, was really helpful, and take care.